Do you frequently feel like your heart pounds, even when you're just sitting? Or maybe you're super tired, even after a full night's sleep. What if you're craving salty snacks like crazy? These might not just be random feelings. They could be signs that your body isn't producing enough of certain hormones. That's where Addison's disease comes in. Imagine your adrenal glands are like little phone batteries sitting on top of your kidneys. Normally, they send hormone texts to keep your energy, blood pressure, and body salt in balance. But in Addison's disease, these glands can't send enough messages. So your body gets confused, like a phone stuck on 1% battery. It struggles to cope with stress, make energy, or even keep your blood pressure steady. Sound relatable? Let's explore what's really going on. So what causes these tiny adrenal glands to stop working? Think of it like a mistaken attack in the body. In about 80% of cases, your own immune system, which usually fights germs, accidentally attacks the adrenal glands. It's like your body's security team turning against its own power generator. Doctors call this an autoimmune disease. Other causes, infections like tuberculosis, can damage the glands too. Imagine mold slowly covering a battery and making it useless. Less commonly, bleeding into the glands maybe. After a bad car accident or cancer spreading, there can also shut them down. So it's not one single villain, it's a few possible culprits messing with your hormone supply. How do you know if your adrenals are struggling? Let's play detective. Have you been feeling unusually weak, like climbing stairs feels like mountain climbing? That's common. What about darkening of the skin, like getting a tan without sun? Especially on knees, elbows, or gums. That's a big clue. You might feel dizzy when standing up quickly. That's low blood pressure shouting for help. Craving salt like never before. Your body's way of saying, I need more balance. Nausea, belly pain, or even mood swings can pop up too. And women might notice their periods becoming irregular. It's like your body is sending multiple emergency alerts. If you or someone you know has several of these signs for weeks, it's time to check in with a doctor. How do doctors catch this quiet thief? First, they'll ask about your symptoms and may do blood tests, like checking your hormone levels. Two key hormones they test are cortisol, your body's stress helper, and ACTH, the message from your brain to make cortisol. In Addison's, cortisol is low and ACTH is high, like the brain shouting, wake up, but no one answers. They might also do a stimulation test, give you a hormone shot, and see if your adrenals respond. If not, that's a strong clue. Treatment, it's not a cure, but it's very manageable. You take daily hormone replacement pills, like swapping your broken battery for a working one. Usually you take cortisol like medicine, like hydrocortisone, and sometimes another for salt balance, fludrocortisone. During sickness or stress, you may need extra doses, kind of like charging your phone more during a long trip. With the right meds, most people live full, active lives. Can you stop Addison's disease before it starts? Well, if it's caused by your immune system attacking your glands, we can't yet prevent that switch from flipping. Kind of like we can't stop a computer glitch before it happens. But you can prevent a dangerous situation called Addisonian crisis, where your body shuts down from lack of hormones. How know your body? If you're diagnosed, always carry emergency meds, like an injectable cortisol. Teach family or friends how to help if you collapse. Wear a medical ID bracelet. Also, during illness, fever, or injury, increase your medicine as your doctor showed you. Don't wait. Prevention here is about being prepared, like having a fire extinguisher ready before a fire starts. Science is always moving. Recently, researchers are working on smarter ways to replace hormones. Right now, pills give a fixed dose, but your body usually makes more cortisol when stressed, like before a job interview. New projects are testing smart pumps, devices like insulin pumps for diabetes, that slowly release cortisol based on your needs, almost like a real gland. There's also gene research trying to understand why the immune system attacks adrenal cells, hoping one day to stop it early. Some studies are even using stem cells to grow new adrenal cells in labs, like growing a spare battery. It's still early, but these ideas could one day change treatment from daily pills to real healing. Exciting, right?